Coming up on this edition of Special People, Special Issues, what if you can cure yourself? Coming up next, cord blood cells. Stay tuned.
BronxNet. Your voice, your views, your vision.
The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
Welcome to this edition of Special People, Special Issues, the program that focuses on the needs, concerns, and achievements of the differently abled. I've always been your host, Lawrence Seiler. On this fantastic edition, we will be discussing cord blood cells and cord blood cell research. With me to discuss this fantastic topic is Dr. Afriye Amerson from Hackensack Medical Center. Thank you very much for joining me on this edition of Special People, Special Issues.
Happy to be here, Mr. Seiler. Thank you for having me.
Okay. And suppose you can cure yourself, but describe to me what is cord blood cell and cord blood cell research.
Well, again, Mr. Seiler, I'm very happy to bring this topic to your viewership and to your program. It's a very exciting topic for the differently abled and gifted population, because when a newborn is born into the world, the first thing we do as obstetricians, which I am, is to cut the cord. And once we've cut the cord, the umbilical cord and the placenta of the baby are generally thrown into the garbage because we did not know how to make use of it. We are now able to take a needle, put it into the umbilical cord, draw the blood and collect it. That blood can then be frozen and stored and then used for transplant to cure disease. Okay. So currently, we know that there are over 70 diseases that we can cure using the cord blood cells from the umbilical cord after the child was born. One of the things that's curable is leukemia, lymphoma. So cancers are certainly able to be cured. Yes, in a different category, regenerative medicine, which is very exciting. Cerebral palsy, spinal cord injuries, looking at Lou Gehrig's disease, muscular dystrophy, and many different neurologic conditions. Again, there's research being done. And in the case of cerebral palsy, there's a doctor from Duke University who's a transplant surgeon who has already effected cure for 9 children that were born with cerebral palsy. In the category of metabolic disease, we're able to cure things such as sickle cell anemia. So it's a very exciting area of research.
Okay. Now, in the research that I've done and the research that you've done, I've come across there's an agency that you're affiliated with, LifeBank USA.
Correct.
Can you explain a little bit about what they do?
Okay. LifeBank USA is one of the private cord blood banking companies. Private means that a family where a woman is pregnant can begin already to make the decision for that child that they're going to bank the cord blood. When a family makes that decision privately, LifeBank USA is the only private company that offers also banking the placenta, which offers additional source of potential stem cells. And those cells are then going to be used again to effect cure. So the cord blood banking company, LifeBank USA, again, is a company that would be contracted by individual families in order that they can bank when that child is born, and then if anyone in the family has a disease, including that child, they would be able to go back and use the cord blood cells to effect a cure of the disease.
Has the research been done on adults yet?
The research on adults is still coming forward. So right now, the cures that have been done due to the volume of cells that are collected at the time of birth, have been primarily with children. And the volume of the cells, so this is the importance of using the placenta as well, will determine the size of the person or the weight of the person that's able to be cured.
I noticed that you have some diagrams there. Can you explain how the process works?
Well, one of the diagrams that I have, Mr. Seiler, is just talking about the process that we collect at the time of birth. The processing is actually done at the laboratory, and
Okay.
the storage is at minus 198 degrees Celsius. So,
Which means what exactly?
which means it is freezing temperature. We put it in liquid nitrogen.
Okay.
And if you think this is the way that we also store sperm. So many people donate sperm. It can stay in that cryogenetically frozen state for 15 years, 20 years, as far as we know, for decades.
So you're actually freezing the blood
you got it.
until you come back to it later.
Until we come back to it later, which even can be decades until we actually use it.
Okay.
Then I also brought something that's going to talk to us. This is back to the question that you asked me about Life Bank USA. Well, in the United States, in general, anyone who has sickle cell anemia, cerebral palsy, leukemia, lymphoma, etc., and is looking for a match for cure, that they have not banked their own stem cells, then the likelihood of finding a match through the public is about 30% for the average American.
Okay.
And for minority groups, specifically African American, Native Alaskan, Native American, and Latino, these groups are far less likely to find a match through the public system. So that's one of the problems, Lawrence. It's one of the reasons that it's important to talk about this on this show, is because babies are born in this country. We have 4.1 million babies that are born every year, but the cord blood is not being banked. Only 5% are banking. This is showing us a little bit about what happens if we publicly donate the cord blood, and what happens if we privately bank the cord blood. So they are both options that are available to prospective families.
What percentage of babies born every year do you know that might have a special need or disability? Do you know those figures?
We know that up to 20% of babies that are born within their first 20 years of life will have some neurologic condition that may arise. We know that in a lifetime, the likelihood is about 1 in 200 that a child would need to use their own cord blood. When we think about the family as a whole, then that statistic changes greatly. For example, research now is including looking at diabetes for cure with the cord blood.
What about autism?
Autism is a possibility. There's not ongoing research right now because we're not even clear as to what environmental factors may also contribute to the development of autism.
Because autism can be somewhat caught through the embryo, through the
In the fetal
Yes.
stages, we don't know, and then after birth, what are the things that may affect it? And this is why one of the topics being looked at was vaccines, although there's not been good evidence to show a correlation. Is it after birth or is it before birth that happens is very unclear. But what is clear, again, is that the national system in this country, the same as you can donate bone marrow to the national system, there is a national registry for cord blood, so that everyone pregnant can make the decision, if they don't bank for their family, to donate the cord blood to the public. And that way, when persons are seeking cure, they can actually find a match.
Now, what is I know there's somewhat of controversy that happened a couple of administrations ago with the president saying that it had to do with the embryo, etc. Can you explain the difference, and could you kind of alleviate some of the scare that people were scared about?
Absolutely. It's very important to understand that there is a difference between embryonic cells being used and cord blood cells being used. So an embryo is referring to the first trimester of pregnancy. If for some reason the pregnancy is abrupted, is stopped. That embryo is not moved forward to full development and then life. Sometimes that will occur for medical reasons, and we know miscarriage exists.
And stillbirth also exists.
Stillbirth exists at the conclusion of the pregnancy. In the first trimester, a woman may miscarry, or there may be something that's told to her that this pregnancy is not viable, the pregnancy cannot continue.
Okay.
In that case, now we have an embryo. And there is a lot of controversy and ethical questioning as to whether you should be able to use this tissue of this embryo in this abrupted pregnancy and do research. But this is not what we're talking about today. And the beauty of the cord blood is the baby has already been born.
Yep.
The life has already been guaranteed into the world, and you have the umbilical cord. And what we're saying is that the umbilical cord is still rich with cells capable of curing disease for the baby, for a sibling of the baby, or a family member of the baby, and if not for the family, donate it to the public, because there is no downside to that. There's no ethical question about the use of the umbilical cord after the child is safe and been born healthy into the world.
Okay. Now, I know here that you gave me, I mean, you don't have to use names, but you gave me a success story in front of me about a child who had cerebral palsy. Could you explain a little bit about that case and how it helped that child?
Well, as I said, there is a doctor from Duke University who has cured 9 children of cerebral palsy, and that research is ongoing. Dallas Hextel is a child who at 18 months had the diagnosis of cerebral palsy, was unable to speak, was unable to walk, and had many developmental delays. And a transplant of his cord blood was given to him. So when he was born, prior to his parents knowing that he had that diagnosis of cerebral palsy, they decided to bank his cord blood. It's a once-in-a-lifetime opportunity because the umbilical cord is only there at birth. After that, it's gone. And thank goodness they banked it.
Now,
So they used it. It was transplanted to him. When he woke up from the transplant, Mr. Seiler, he was able to say, "Mama."
and he wasn't
to
able
walk.
to say mama before.
He was not able to speak at all before. He was able to walk, which he was previously unable to do. And he has been making significant advances since the time of his transplant.
Now, you mentioned that doctors and surgeons throw that stuff in the garbage.
Correct.
Why? Is there a reason?
A family has to make a decision. It's their right, as well as their responsibility, to say to the doctor or the midwife, whoever will be performing the delivery, I want to bank my cord blood cells when my baby is born. And if parents don't make that decision during the pregnancy, it's thrown into the garbage. So this is a very important point because 95% of Americans, regardless of education, regardless of income, are still throwing it in the garbage.
Well, excuse me while we go to break. Coming up next, what if Lauren Seiler is cured with cord blood? Coming up next.
I love it.
Hey, how you doing? Hey, girl, Nicole, good luck on the play tonight. You're welcome. What's up, guys? Now you're gonna make sure that you return those on Monday, right? Thank you. Oh, nice.
Quit talking to you for a second. Go ahead, no. Get your water. Come on, let me get your water. Just get out the way.
happened to your face?
Welcome back to Special People, Special Issues. With me again is Dr. Afriye Emerson from Hackensack Medical Center, and we're talking about cord blood. And as I said in the break, what if I can cure myself? Now, one of your research, one of your patients, it mentions that a 35-year-old man was cured of some type of cancer.
Yes.
Can you explain the rest of your diagram in terms of how
Okay.
the...
So most families can relate to cancer. And the reason we can relate to cancer is because unfortunately our family members are still suffering it. So it's important, again, to understand what our availability of cure is so that we can reduce disease in this country and save our family members. The first thing to understand is that when it comes to cancer, we generally and traditionally have looked for bone marrow transplant.
Okay.
One of the problems, any family that has been through a bone marrow transplant, is that there's a high level of rejection.
Okay.
So you get your hopes up and you have a match and you're transplanted and you're hoping that this family member will be cured and will survive. And what happens is the body figures out, you put something in me that is foreign. And when it figures out that it's foreign, then it can reject it. And if those cells are rejected and the person is struggling with cancer, then that's their death. They cannot survive that. So rejection is very serious when you are transplanting cells one person into another. This is why even with blood transfusion, there's so many checks to make sure that it's the appropriate match and you don't cause more harm than good. Well, when we talk about cord blood stem cells, we are talking about cells that are having even greater capacity in fighting cancer than the bone marrow. When we have a match of the cord blood, it's immediately available.
Got you.
As opposed to the bone marrow. If you give your bone marrow, that is a lengthy process through which it has to be collected from you and then can be used to save your family member if it matches them. There's a simpler collection process, obviously, with the umbilical cord. You don't have a surgical harvest. You have a reduction in the time to treatment. You have a decrease in the frequency of infections that will come up as a result of transplant. More tolerant HLA mismatches, which means, sort of think of the naivete of birth. You're innocent at birth and then you come into this world and you learn things and you pick up bad habits. Well, your body is the same way. Your immune system at the time of your birth has a naivete to it, so that it can adapt into your brother's body, your sister's body, another family member's body, and become that person in a more ready way than when we're using the bone marrow of children or of adults. Because we're taking it at that moment of birth, it actually matches better. It is less likely to be rejected from that person. And then overall, there's a better immune function long term. This is just talking about what the stem cells are. Because when we say stem cell, then it can come from the umbilical cord, the bone marrow, the blood, or the embryo. But again, we are specifically talking about when it comes from the umbilical cord, and that's why we're saying cord blood banking is what we're talking about. These cells are the master cells that are used to build every other kind of cell in the body. So whether we're talking about the liver, or the skin, or the muscle, the blood, or the nervous system, the brain, the heart, it all comes from an originator cell. Okay. And this is what's in the umbilical cord. So again, let's use yourself as the model. We know that we are able to effect cure with cerebral palsy.
Yep.
And also youth is restorative. So the younger that we affect that transplant, the greater the likelihood that it's going to immediately take effect and we notice a difference in cure in that person's body. For you, the first thing we would have to do is to find a match. Because when you and I were born, this was not available. So nobody in our age group has cord blood cells that were preserved for them. Now just imagine the children that are being born today, they have a whole new opportunity, a whole new reality. Should they suffer burn? Should they develop disease? Should they develop cancer? They have options that we did not have. So for you and I, we're looking to the National Registry to see, is there a match for us? If we give birth to a child, there is the potential that there is a match for us. In banking the cord blood cells, there's research now in, okay, I may have collected this volume of cells, and this volume may be enough to cure someone up to 100 pounds. But what if I need to cure 3 people in the family? Or what if the person needing cure is 200 pounds, not 100 pounds? Can I take the cell and multiply it, make it multiply itself? We're doing research on that now, cell amplification, so that that can also be a strategy, finding a match, amplifying the cells, affecting the transplant. Lawrence Seiler would be cured.
Yep. Hopefully that happens. Now,
Brilliant question. Brilliant question.
next.
This one we talked about. This is the current uses of the cord blood cells. We use them in blood disorders. Sickle cell anemia, aplastic anemia, Fanconi's anemia, beta thalassemia are all curable. We use them for malignancies, including multiple myeloma, and we use them in metabolic disorders. And there's research now using it for the spinal column, the heart, and for diabetes. And this we talked about. And this is just showing, once again, what we're already doing research and showing promise in: eye disease and blindness, diabetes, brain and spinal cord injuries, stroke, ALS, muscular dystrophy, and liver disease. Parkinson's, very important. There's
So
research
Michael J.
already
Fox
ongoing.
would be cured then.
There are so many people, even in the celebrity community, that have been affected. It's universal. The effect of disease does not discriminate because of income or because of education. And that is the beauty in being able to universally utilize this. So this is looking at the heart. And there already are studies underway that have shown promise in being able to restore the heart to its original function after a heart attack,
Okay.
using the cord blood. There already are studies showing, again, promise in all of these categories in brain regeneration. Regeneration means going from a damaged state to a completely restored, whole state that is disease-free. In type 1 diabetes, your pancreas is no longer functioning and of use to you, and we have shown evidence of restoration of the pancreas, and therefore cure of diabetes type 1 with the use of the cord blood cells. And finally, this is showing that even our blood vessels, because again, when we have a sperm and the egg in the womb create a pregnancy, everything is created out of nothing. And those cells that create something out of nothing are the very cord blood cells we're talking about. So even blood vessels, when we have damage to our blood vessels, peripheral vascular disease, etc., we have shown evidence that the cord blood cells can go into the body and make all new blood vessels for our bodies.
We're going to wrap it up.
Okay. Well, I would like to thank you
Thank
for
you.
joining me on this edition of Special People, Special Issues. It's been very informative, and come back again. When we come back, the Special People, Special Issues Bulletin Board. Stay tuned.
Can you tell which of these children was not born free? Can you tell which of these children was not born equal? Can you tell which of these children does not deserve to be treated with dignity? We can't either. Human right number 1. We are all born free and equal. What are human rights? Find out at youthforhumanrights.org.
So dude, I did the most shocking thing today. It was just something I never thought I'd do.
Did your parents find out?
My mom cried.
What'd you do?
Now let's turn to the Special People Special Issues Bulletin Board. It contains numbers and information featured on today's show. For more information on Dr. Afriye Emerson and her work, you can contact Dr. Afriye Emerson, OBGYN, and she's also a speaker and founder of La Doctora's Angels, a cord blood banking awareness campaign. You can reach her at www.afriye.com. That's www.afriye.com. Well, that puts an end to this edition of Special People Special Issues. Soon I'll be cured. Stay tuned. I'm Lawrence Seiler. See you next time.
The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Coming up on this edition of Special People Special Issues, the second part of this series on cord blood cell research. We have Dr. Afriye Emerson from Hackensack Medical Center. Stay tuned for this medical edition. Welcome to this edition of Special People Special Issues, the program that for the past 11 years has always focused on the needs, concerns, and achievements of the differently abled. I've always been your host, Lawrence Seiler. On this very powerful medical edition, we have been focusing on cord blood cell research. This is the second part of a three-part series. We have Dr. Afriye Emerson from Hackensack Medical Center. Thank you for joining us again on this edition of Special People Special Issues. Thank you so much for coming in.
It's an honor to speak to your viewers, Larry. Thank you.
Okay. Last time we gave a general overview of cord blood cell research. Can you basically tell us again what that is?
Okay, and indeed we gave the viewers last time the overview. And the overview is that the baby is born into the world. Healthy, we cut the cord, and at that point, the umbilical cord is still connected to the placenta. Mm-hmm. And rather than discard the umbilical cord and placenta as medical waste, we have the opportunity, ever since about 1988, to preserve the cord blood, and that means we're collecting it either privately for the family, or it's being donated to the public. So whoever delivers the baby, right after the baby is safe, decides to collect, the same as you would draw blood from a person, from the umbilical cord, the blood. Okay. And that blood, again, is then taken to a laboratory, frozen, and able to be retrieved at a later point to cure disease. And there are over 70 diseases that are curable using the cord blood cells. Okay. Some of those diseases are sickle cell anemia. So there are many children who've been born with sickle cell anemia, who are dying essentially of sickle cell anemia, and who then can be cured of their disease permanently. Okay. using the blood from the umbilical cord. Another example is leukemia.
Cancer.
Cancer. And we know that leukemia is something that affects hundreds of thousands of children across the country every year. If a child has leukemia, they are primarily treated with chemotherapy. Many children are not able to be cured by this. And so the doctors that are treating that child's cancer have an opportunity. If that child's cord blood was saved, if that child has a sibling whose cord blood was saved,
Or siblings.
or siblings, the more the better, because the more times a family banks cord blood for a child, then each child that comes in increases the probability of a match for all of the siblings.
Okay, now what happens if there can't be a match? Is the child put on a registry or a list? But how long does that go on for?
That is such an excellent question for your viewers. If there is no match, number one, if the child doesn't have any sibling with cord blood, or there is a sibling with cord blood but it doesn't match, then the child would look in the National Marrow Donor Program, which has been created in our country by the government. Since 1987, the National Marrow Donor Program has a registry, as you mentioned, and that registry keeps track of any donation to the public of bone marrow that can be matched to children and adults who are seeking cure to their disease. So the child would be put onto that registry. And what is the likelihood that they would find a match? If it is a Caucasian child, about 70%. If the child is a child that is of color, then the probability of a match decreases very significantly. If the child is mixed ethnicity, then the probability decreases even more rapidly. So that there are certain subpopulations ethnically which face as low as a 4% chance of matching.
Why is that? Is there a particular reason, or can you tell our viewers that?
Well, because we're not donating enough. As a country, as Americans, the donation of bone marrow, if we ask everybody we know, have you donated your bone marrow ever? Most people are going to say no. And so that's problem number one. Donation of blood, we've done a much better job than we were doing, let's say, 30 years ago. But when it comes to the cord blood, this is what's so exciting, and this is why it's so magnificent that Special People, Special Issues is featuring this 3 times to educate your viewers, is because the cord blood is a no-brainer. When a baby is born into the world, there's no use for their umbilical cord after that point, unless we preserve it. Now, imagine a country in which every child born donated their cord blood to the public.
Then you would have a lot of diseases or informalities, no more.
You got it.
For example, you mentioned offset, that because today I want to talk about several things. We spoke about cancer.
Yeah.
What about diabetes?
This is exciting. There are 2 types of diabetes.
Type 1 and type 2?
Type 1 and type 2. Type 2 is completely avoidable. Type 2 happens generally to an adult, maybe middle-aged adult, and the adult often is obese, and that person may or may not need insulin.
How obese does a person have to be to get insulin?
It's not an exact proportion, weight in proportion to how much insulin you need, because there are many different forms, again, of the diabetes. But type 2 diabetes, for the most part, is an obese population. And so that, again, you can prevent that by weight management and nutrition and healthy living. But type 1, you can't avoid.
Now
You can be born with it. You can develop it as a child. You can develop it as a teenager or as a young adult. You can be thin and healthy and athletic, and you get type 1 diabetes, and it's the worst one to get of the 2 because you have to take insulin.
Now I'm going to ask you about this. How can one live or be, living healthy in terms of America, because there are thousands or hundreds of fast food restaurants in America. So how is one eating healthy if America's eating on the go? I mean, this is ridiculously important, for us to tell America that, look, you have to eat healthy so you don't get diabetes, you don't get cancer, you don't get these things.
You got it.
That kind of thing.
It actually is the most important message for your viewer, is to understand what control they have in preventing their own disease onset. If you are born into the world as a healthy person, that is amazing. And if you are born into the world with any abilities whatsoever, which we all are, then again, that's the beauty of the show, is that everyone has certain abilities that they are coming into the world with, be they mental, physical, through their senses, or through their hands, or through their experience, or through what they bring to other people. When you have it, you have to protect it.
Now, on the table, I noticed that you brought a diagram of the human body. Can you kind of explain how the cord cell blood works through our own system?
Okay, I'm going to finish what we said on diabetes. We explained the two types of diabetes.
Okay.
Type 1 is the worst. And type 1 diabetes is your pancreas. And your pancreas at this point is not producing the insulin that you need to live, to survive. We have studies that have been published that show that type 1 diabetics can be cured with the cord blood. And from 2007, the Journal of the American Medical Association has published literature showing that even adult stem cells, meaning we're taking from an adult human being the cells in their body.
At what age are you guys?
Any age.
From 20 on up?
That's right. Adult population can take their own stem cells and cure diabetes. Type 1, which is the battle that we are fighting the most as a healthcare industry. Type 1 diabetes is the one that is the killer of people because, again, it is affecting children, teenagers, young adults. It's not preventable with the healthy living that we mentioned before.
Okay.
So again, diabetes, cancer, these are two of the diseases that are curable, but it's not just one type of cancer. There are many types of cancer that can be cured with the cord blood. And also type 1 diabetes, and those studies are still ongoing. And your viewers can go to websites to learn more about how to cure type 1 diabetes. www.cordblood.com is one website that they can go to and learn about how to enroll their family members who may have type 1 diabetes, and how to, as a pregnant woman, bank the cord blood of their children in the hopes of, as you said, eliminating type 1 diabetes completely. We can eradicate disease if everyone is participating in cord blood banking.
Now you mentioned, you mentioned diabetes, okay? There's the good blood and the bad blood with the hemoglobin and all of that. Infusement, how does that work with cord blood? How do you test both the good blood and the bad blood?
So I would describe it a little differently, that in our blood there are various parts. There are red blood cells, there are white blood cells, there's the plasma, and when we collect the cord blood, all of it's there, like you said. So then there is a process that cord blood has to go through in order to be prepared so that you have isolated only the stem cells. And that process is a very complicated process that takes place in the laboratories. And those laboratories then are having staff that are trained at how to use the centrifuge machines that are used to isolate the stem cells, all of the, quote, the bad blood, that would be infection. If the blood is infected, then it's going to be tested, and once the infection is detected, the blood cannot be used. So if the blood is found to be free of infection, then the stem cells are isolated through centrifugation process. And after the centrifuge process and the isolation of the cord blood stem cells, then it is frozen in tanks where it can be stored indefinitely. And again, how long can we use it? What's the lifespan?
You mean cryogenically?
You got it.
Freeze the blood.
Yes.
Okay.
Yes. How long can we use it after that? We've had studies to show that at least for several decades, but the probability is for much longer.
Okay. Well, let's take a break and continue after this. More on stem cell and cord blood cell research with Dr. Afriye Amerson when we come back after these messages. Stay tuned. Welcome back to Special People, Special Issues. Let's continue the discussion that we're talking with Dr. Afriye Amerson of Hackensack Medical Center. Welcome back, and let's continue the discussion on cord blood. What other diseases? Now, I'm going to ask you a question, and you're probably going to tell me no. Does cord blood handle or deal with seizure disorders like epilepsy?
The answer, you're absolutely right in your intuition that the answer is no at present.
And why?
We can go back to the model that we used. The cord blood cures that we are currently able to do are all involving situations where there is an injury to an organ.
Okay.
Or the cells of an organ have, quote, malfunctioned. And when there is a malfunction of the cells, then the cord blood cells are able to go to that area of the body. Heart disease, Alzheimer's disease are two diseases that are currently under research because there can be an injury to the heart. There can be an injury to the brain.
So with Alzheimer's, if someone loses their memory, for example, the heart can also stop pumping, correct?
That's right.
Okay.
And in both of these situations, medicine is able to identify, to point to where the problem happened. The problem with seizure disorder is that we cannot point to where the problem happened. A person can have a normal brain that is not damaged in any way, and the cells are not damaged in any way. So the cord blood may not be applicable. We don't know. Our children may discover and figure this out, but that's the realm of the unknown in science right now. But what we do know is that, again, you can have a completely normal brain and suffer with seizure disorder because there is some electrical firing that is occurring in that normal brain to cause the seizure.
You mentioned also the registry. Can you explain about the registry or the website that the registry is on?
Absolutely.
So people can get a chance to write in or send emails?
Absolutely. So let's go over some facts and figures. The National Marrow Donor Program Registry is a registry that includes more than 6 million potential volunteer marrow donors and more than 50,000 cord blood units. And it is listed through bone marrow donors worldwide. So National Marrow Donor Program is what your viewers should seek in terms of looking at the website and having an understanding of what this is. It serves all communities, and the registry has been serving and keeping track by ethnicity of the availability.
Caucasian, mixed, etc.
Yes, yes. So Native Hawaiian, Hispanic, American Indian, Asian, Black, and what the numbers are in terms of participation of various ethnicities in this registry. And again, what it shows is that as we look at mixed ethnicities, there is decreased participation. And a lot of that has to do with the fact that people do not want to donate their bone marrow. It's painful. You have to be in pretty much perfect health in order to qualify, and the procedure takes time. But when a child is born into the world, you already have everyone that is needed present for this amazing opportunity that is once in a lifetime for that particular child. That is the perfect opportunity for all ethnicities to participate equally in the National Marrow Registry Program by donating the cord blood. And the viewers can learn how to participate in this by looking at the National Marrow Donor Program.
You also mentioned the regenerative medicine registry. Can you explain about that as well?
Yes. Regenerative medicine means we are reinventing something that you already had in creation and that was damaged. So it's an extremely exciting area of development in science. And in this area, there are studies undergoing that are looking at hearing loss. So we know that many children are born with normal hearing, and then due to some injury or some accident or some illness,
and they lose their hearing.
They lose their hearing. If that child has banked their cord blood, not donated it to the public, but privately banked it so that they have it for their use, then they can use that cord blood to potentially restore normal hearing to that child. And your viewers can also, again, go to www.cordblood.com/hearing loss to learn how to participate in that study.
Are there any other diseases or informalities that cord blood cures that we haven't mentioned as of yet?
In the area of regenerative medicine, it's also important to say that there are studies that are undergoing that are looking at vision and the loss of vision through various means. There are also studies that are looking at the spinal cord, which can be injured. We all know about Christopher Reeves, and that paralysis is something that strikes people and can be devastating. There are studies that look at both adult stem cells as well as looking at the cord blood cells in being able to regenerate a normal spinal column after injury. And then also the cord blood, again, is having research in looking at skin and tissue regeneration for burn victims, for example.
So in other words, if someone was in a fire,
Yes.
or a really bad fire, had
Yes.
second, third, and fourth degree burns, how would that help someone with cord blood?
The person can explore through the same modalities of the other illnesses that we talked about, using their healthcare provider to learn about whether or not, number one, using a transplant of stem cells is going to be useful to them. And then finding a match. And finding a match, that person would then be able to receive a transplant. And the transplant is a very simple procedure, almost like receiving a blood transfusion.
What are the future, or how does the future hold for cord blood recipients or the registries itself? Because this is an ongoing process. Can you explain to me how the future holds for cord blood cell research itself?
Well, I think the future is extremely exciting for cord blood research because just in the past 20 years, we have been able to discover cures for over 70 diseases. The participation can increase now exponentially, and what that will do, as you stated before, is it will increase the likelihood of match.
Now, why are people afraid, though, of donating bone marrow and, their organs to cord blood cell research? Why are people afraid?
I don't think they're afraid. I think they're uninformed.
Okay.
I think that people do not know that when a child is born, they can bank the cord blood. And then when it comes to bone marrow, as I said, I think that there are many barriers to that. But in terms of why are we still as a nation having less than 5% participation in banking the cord blood, it's lack of awareness. And so it's with that understanding that I brought in for you information about a campaign that I've started to raise awareness on cord blood banking. And so it's called La Doctora's Angels, and I am fluent in Spanish, so I chose that name because it will include the Hispanic population in participation. And what it does is it utilizes nurses who I think are leaders in the community in terms of advocacy and education. And these nurses are going out into the community and educating one woman at a time that they have the option to bank the cord blood of their child when the child is born, not to just throw it in the garbage as medical waste.
Is there anything else that you would like to say about cord blood cell research before we end that people should know?
Just finally, that everyone that is a viewer, whether they themselves are pregnant or have a family member pregnant or simply know someone in their community that is pregnant, should absolutely, as a result of this show, go and make sure that that person knows that they have the option to either donate it to the public for free or to privately bank it and keep it for the cure of disease within their own family.
Are there any other cord blood cell registries that people should know about that we haven't mentioned?
No, you have comprehensively covered it.
Okay.
Lawrence Styler, thank you.
Okay, no problem. Well, I would like to thank you for joining me on this second part of this series on cord blood cell research. When we come back, the Special People Special Issues Bulletin Board. Stay tuned right after this.
These things we count on every day started as ideas. Ideas from the minds of African Americans. Support minority education today so we don't miss out on the next big idea tomorrow. The United Negro College Fund. A mind is a terrible thing to waste.
Hey, how's it going?
Sir, are you okay?
What? Oh, this? It's probably nothing. I'm sure it'll go away.
Go away? But, sir, that can't be good.
No, it's cool, really.
Do you want a napkin or something?
Everything's fine. Thanks.
You wouldn't ignore this. So why ignore the signs of a stroke? At the first warning signs, call 911 immediately. Because time lost is brain lost.
Now, let's turn to the Special People Special Issues Bulletin Board. It contains numbers and addresses featured on today's program. For more information on Dr. Afriye Amerson's work in general, you can contact her at www.afriye.com. But for more information on her cord blood cell registry, La Doctoras Angels, in Spanish, that is dealing with parents of Spanish-speaking families, you can also contact her at www.afriye.com. Also, for information on regenerative medicine and hearing loss, you can go to www.cordblood.com/hearing loss. Well, this puts an end to this edition of Special People Special Issues. As always, I'm Lauren Seiler. See you always next time. Stay strong.